If you have ever called a patient 10 times to get them in for a preventive screening and they still didn't show up, they still did not come, then this video is for you and your practice. Here's a real problem. The patient sitting at home is thinking, hey, doctor, you get the incentive. Insurance gets the premium. Where is my reward? Everyone wins except me. Why should I bother? So, today we are going to flip that script because many insurers are already paying patients to complete screenings. Most patients have no idea, and most practices aren't telling them that they can get rewarded if they complete their preventive screenings. What I often hear from practices when they are trying to close care gaps, when they are trying to earn incentive, is that the patients they don't show up, right? You schedule the patient over and over and over again, and they are still not showing up. So why? Why is that happening? Why patients they don't show up? Because there is no immediate personal reward for the patient. Yeah, there is long-term benefit. They will be more healthy, but there is no immediate personal reward, right? Like a practice has. A practice is getting reimbursed for the fee for service as well as under the value-based care incentives. But the patient is not getting anything immediate. So probably the patient is like, hey, I feel fine. There is no urgency, no sense of urgency. Or they are not aware that the plan covers it, that the plan offers reward to complete them screenings. So nobody told them that there is a dollar in it. Okay? And that shift needs to happen in value-based care particularly. Because insurers, they are already rewarding patients for completing the screenings. It is the real cash that the patient can earn and use it towards their daily needs as well. Here we have few of those payers. These are 6 major commercial and Medicaid payers that actively reward members for completing healthy activities and screenings. We will walk through each one of these to get an idea what kind of reward the patient is getting so you as a practice can help your patient to understand the reward that they can get. Utilize this information to help the patient complete the screening, help them get the reward, you get the incentive, you get the care gap closed, they get their reward, everybody's happy. Make sense? So let's see. Let's jump into each one of these pairs and see what kind of rewards they have for the patient. Let's see UnitedHealthcare. UnitedHealthcare has many different rewards for members based on their plan. Okay? So one of the rewards is UHC rewards, which is if you have UnitedHealthcare through an employer-sponsored plan, then you as a member or you as a patient can earn up to $1,000 a year. And a UHC member can get $40 just for activating the program. Then activities like, getting an annual checkup, they pay $50, a biometric screening, it pays $75, and even connecting a fitness tracker, it pays $65. And these rewards, they go onto a digital Visa gift card or they directly go into the member's HSA account. So basically, if you are a practice, tell your United Healthcare patients that your insurance is literally paying you. Just activate the app. So here we are on United Healthcare website, and we can see that there are different wellness and reward programs based on the plan type. We discussed this one, which is United Healthcare Rewards, which is one of the reward types that you can be eligible if you have an employer-sponsored health plan. United Healthcare through an employer-sponsored health plan, right? Then we have other rewards as well. One Pass Select, which helps you to reach your fitness goals, find a routine that's right for you. Then you have another, which is Velos, and then Care Cash. So there are different reward buckets which you can be eligible for. And if you have a Medicare Advantage plan, then there's a different set of rewards that might be applicable to you than if you have a Medicaid plan. Member rewards for that are discussed in this section. If you have an ACA plan, and the rewards for those are discussed here as well. Okay. So with rewards, the thing is that members are often confused how we can utilize these rewards or how to activate if there is any card, how we are going to redeem that reward. And for that too, there are resources which are online available. Here I have UnitedHealthcare Rewards, frequently asked questions, and it has really um, good questions that members or patients have regarding how they can use the reward, how they can get started and start earning once they have completed their screenings and all the healthy activities. If you're a practice, you might want to know this information in advance so that you can guide the patient better on how they can redeem the reward. So I think there is also a section on reward redemption here, which is this one. How do I redeem my rewards? And here they have discussed which accounts are to be used in order to um, realize the reward and to spend it, and where to spend it, how to spend it. So these are important questions, and some exceptions as well, like only UHC rewards HRA accounts can receive deposits from UHC rewards. We are unable to make deposits to other HRA accounts. Okay, so these are some exceptions that your practice might want to know if you want to guide your patients better on how to redeem these rewards once they have completed their screenings. Okay, so yeah, this is for United Healthcare. So another pair that is rewarding the patient to complete their screenings is Ambetter. Ambetter, which is Centene's marketplace brand, has a program which is called My Health Pays, and members can earn up to $572 per year. And one of the best features is that patients can use these rewards not just for health items, they can pay rent, utilities, monthly bills with this card as well. All right. And if you are a practice and for your Medicaid and marketplace patients, this is incredibly motivating. The practice doesn't need to do anything extra. Rewards are automatically credited into patients' or members' account once the claim is processed correctly. Okay? So this is Ambetter, My Health Pays program, which you can see here. My Health Pays, make healthy choices and earn rewards with My Health Pays beginning January 1st, 2026. You can earn up to $572 per calendar year with our My Health Pays reward program, a program that pays you for healthy decisions you are most likely already making every day. Okay. So basically, it is in the form of points, and the points are then converted to cash, which you can then use at online stores. You may qualify to earn up to $200 worth of rewards for getting preventive screenings or tests you regularly do. Okay, so if you are a practice, you are struggling to get and better patients in, and they are not doing the screening, you might want to add this information, or you might want to use it effectively when trying to engage with the patient to get the screenings done. Okay, that hey, um, this is the reward if you complete the screenings. You could be rewarded for getting a colorectal cancer screening. Colorectal cancer screening is one of the most challenging because patients they keep on delaying this. And important thing about My Health Pays is that after you activate your account and start earning points, you can convert them into money. So you convert your points that you have earned into money to help you cover monthly bills. And these monthly bills can be different categories like utilities, telecommunication, transportation, education, rent, childcare. So this is how Ambetter's My Health Pays rewards work. Now we have another reward for members, which is Cigna's Health Today card for Medicare Advantage plan members. And it is one of the most provider-friendly programs because you, as a provider, you don't have to do anything extra. You just bill the claim correctly, and Cigna, it loads the reward dollars onto the patient's card automatically. And there is something called 360 Wellness Exam, which is the annual wellness visit. The patient gets a $50 gift card to Amazon, Walmart, or there are a couple of other retail store options, right? And here is a stat that should matter to every practice manager. And this is from Cigna's own data, which shows that patients who earned an incentive were 20% more likely to complete additional screenings. That's the compounding effect. One reward leads to more engagement all the year. Okay? So why not? Now they are getting something. So the screenings will be on time, probably. Then we have the rewards that patients can get from Humana and Aetna. Humana's Go 365 is their wellness reward platform, and patients earn points for healthy activities that can be redeemed for gift cards and gym memberships. In 2026, Humana also added a zero-cost cancer screenings to their Medicare Advantage plan patients, making this even more appealing to mention to patients. So you know what I'm trying to say. If you are a practice, that is how you get your care gaps closed. For Aetna Better Health, their Medicaid program is called Aetna Better Health. The reward structure, it is very specific and it is very clear as well. Every single activity has a dollar amount attached. Like annual PCP visit has some dollar value attached to it. Cervical cancer screening gets you a separate dollar amount. HbA1c control, another amount. Right? This is incredibly easy to communicate to patients because you can tell them exactly what they will receive for each specific action. So Humana Go 365 rewards for Humana members, for Care Plus members. There are different activities and rewards for Humana members. They might vary, right? But the idea is that your healthy activities are rewarded. Explore healthy living, choose activities, track what you did, earn rewards, and complete activities to earn rewards each year. Once you have $10 in rewards, you can start redeeming them for gift cards to popular retailers in the Go 365 mall. Okay. So, yeah, if you are a practice and you have Humana members, you might check their plan and see what is applicable to them, what reward is applicable to them, and how you can get them in for screening, and how they too can earn reward if there is any reward on certain screenings. Okay. And next we have Aetna, and Aetna also has better care rewards for different activities, and they have specifically mentioned how to register for rewards for Medicaid members, and there are complete steps on registration and how to do it. $25 for annual visit, up to $100 for pregnant moms, up to $80 for babies, up to $115 for immunizations. Cervical cancer screening gets you $50. For A1C, you get up to $50. Behavioral health follow-up, $50. So this is really comprehensive, okay? And these are all the different activities which can get you a reward, which is annual visits. If we expand it, we have annual visits, we have screenings that can get you a reward, which are really hard because patients don't do them, they delay them. So if you have Aetna members, then this is your chance to reach out to them, to get them in for screening, and tell them what they get in return. So now for Healthfirst too, we have different rewards. And this one that you can see, this is for Medicaid and Child Health Plus members. And the activities which are rewarded are well child visits, annual dental visits, and you can see the amount here as well. This is the 2024 form, but if you are a practice, then they might actively tell you what are the forms that are applicable for this year, which is 2026, and then they can give you those reward forms so that you can also guide the patients better. So sometimes insurers will tell you that they are giving rewards, and this is what a practice directly got from Healthfirst, the reward forms, because the practice was facing some challenge because the patients were not closing the care gaps, they were not showing up for the screenings. So yeah, this is for Medicaid members. Then there was another reward form for Medicare members and for HARP members, which is personal wellness plan. If someone has personal wellness plan in Healthfirst, then they can also get rewards on doing colonoscopy, on, you know, Cologuard, and yeah, dilated eye exam, and then they mention the date. So here the process is a little bit more manual. You will have to do the screening, and then the patient has to complete this reward form, and then they have to use mail or fax to send those completed forms to the insurance. And then they have to give it 3 to 4 weeks to process, after which they can activate their card and they can start shopping, and they can earn reward cards that can be used at these participating stores, which is Bath and Body Works, CVS, Foot Locker, JCPenney, and yeah, you can see there are different stores that the rewards which the patient has earned after completing screening, they can be used to buy stuff from these stores. Okay. So regarding the rewards, there is an awareness gap. Okay. And the uncomfortable truth is that the rewards for members, they do exist and they are real money, but they are sitting there unclaimed because nobody is connecting the dots for patients, because everybody is trying to earn their own incentive. Practices keep calling with the same script. Please come in for your screening, with no mention of money. The good news, this is completely fixable. Let me show you the exact script change that can move the needle in your practice. So here is the script, right? So, hi, patient name, this is whatever your practice ABC, Dr. XYZ. Your practice primary care provider would like to remind you to schedule your health screenings before a particular date, right? Here is something you may not know. Qualifying members can earn reward dollars just by completing these screenings. That's real money you can spend at participating stores. Book your appointment here and we look forward to seeing you. So, here is the exact change that you need to make. Instead of generic, please come in for screening call, you add one sentence about the reward. Did you know your insurance actually pays you to complete this? That's it. That is the shift. And the pro tip is to personalize it. If you know that the patient is on Ambetter and the open gap is mammogram, you can say you could earn reward dollar for completing this. Specifically, it gets called back, right? So mention the gap that they have, then mention the reward that they can get. So here is how you can update your care gap closure strategy. If there is a patient that is very hard to communicate and they are not completing their screening, you have done everything but they are not showing up, maybe you need to change the script a little bit. Identify the patient's pair. Okay, number one. Number two, look up their reward program. Based on their program, what reward applies to them. Okay, find the open care gap. If patient has a reward for completing their preventive screenings, then find that and mention it in your outreach. Okay, mention that in your scripts. Update your outreach strategy, and patient will show up when they know that, hey, I'm getting the money. They will. Yeah, they will. We spent so much energy talking about provider incentives and payer bonuses in value based care. It's time that we give equal attention to patient incentives, because that's the lever that's been sitting unused. Share this with your care coordinators, your front desk team, your quality managers, and see how your care gaps get closed more faster because of this little change.